ask this. I want to kind of change it up a little bit. So a number of months ago, I introduced a concept called myths versus facts here on To Your Health with Dr. G. And again, you're listening live on intellectualradio.com as well, too, and watching us on Facebook. But I introduced a concept called myths versus facts. So without further ado, we get the pharmacy version of myths versus facts. So here's how it works. I'm going to say a statement, and then I'm going to pick on one of my panelists, and they're either going to say myth or fact and give us a reason why. Here we go. Veronicas, as you're sitting next to me, you get to go first because you're sitting the closest to me, so that's just how it is. So here we go. Myth versus facts on To Your Health with Dr. G. Here we go. Here's a statement. All right. If pain or discomfort persists or worsens, it's okay to take more than the prescribed dose of a medication.
Oh my God, that's so funny, because I was actually talking to somebody about, they asked me a question about Aleve, and they're like, is there a max you can take on Aleve? I'm like, what happens if I take too much? I'm like, well...
Let me start.
Yeah.
You got a pen and paper?
So no,
more
more does not necessarily mean better, because anything that you take, whether it be medicine, herbal, anything that you put in your mouth, you're introducing it into your body, and it not only can it cause a benefit, like reducing your headache, but it will also cause toxicity. So the more you take, the sometimes can lead to liver problems, kidney problems. So it's a myth.
Thank you. All right, next statement for Lisa. Here we go. Here's a statement. If I feel well, I can skip my medication. If I'm really not feeling well, then I can take more than the label says.
That is a myth as well. And like Veronica said, you can't just take more to, make yourself feel better. And you can't just not take it when you're feeling okay. The medications are intended to, the way that drugs work is they need to get to what we call a steady state in the body. So you want to get to a steady amount of that drug in your blood system so that it exhibits its effect, so that you don't have these ups and downs, whether it's your blood pressure, whether it's your blood sugars. And when you skip the medications, or when you kind of ping pong like that, you're actually creating more harm and making it more difficult to treat your chronic disease condition.
Excellent. Kwame, here we go. Myths versus facts. Here's a statement. Pharmacists just count pills all day long.
Now, that's definitely a myth. Okay, so just to talk about a community setting, counting pills is just one thing that we do, right? The reason why we count it is we have to get it to you. And we don't want to give you more, we don't want to give you less, right? But in community pharmacy, we do a lot more. Whether it's MTMs like Veronica does, we call patients, make sure their medications, there are no duplicates. They are taking it to provide the best outcome. We do a lot in consultation. If you have any questions about the disease that you are treating or your medication, we do that. Smoking cessation. So if you don't know where to start, you can come to the pharmacy. A pharmacist will sit down with you, and they will discuss, what products that will work for you. If you need dietary supplementations, we go over that with you. Self-care. Right now the weather is changed. We have a lot of people walking around. They have a cough, they have a cold. You come out there. Pharmacists will go out there and they will show you what medications are best for you to take. If you went to see your primary care physician, and there is something that you feel that you didn't understand, you can call your local pharmacist. Pharmacists will take the time and go over it with you, whether it's about the disease you went in there for, or even for medication or something that you don't understand. You can get up and go to the doctor's office every week to go and check your blood pressure. You come to the pharmacy, we take care of that for you. Your immunizations,
yep, you guys
take
do
care
it.
of that.
Yep.
So we do a whole lot more.
Excellent. Thank you for dispelling that myth.
Mm-hmm.
Here we go. Myths versus facts. Veronica, here we go. Here's a statement. My pharmacist doesn't need to know about over-the-counter medications or vitamins, only prescription medications.
Well, that's a huge myth.
Pretty much. By the way, you know that these are all myths, by the way. I just throw it out there for everybody to understand. We're always going to say myth.
Yeah. A lot of the patients that go to the pharmacy, just because they think that it's over the counter or it's an herbal or natural medication, that it's safe. Going back to what I said previously, anything that you take, prescription, non-prescription, natural medicine, herbal supplement, anything that you take but can have a positive, but also can have a negative effect on you. It can be toxic, can interact with certain medications, especially patients that are on blood thinning medications. A lot of the herbal medications will interact with a lot of the anticoagulants or antiplatelets. So my advice is that if you have to get something over the counter, go see your friendly pharmacist at Walgreens,
Yes.
and he will help you make sure that you're not having any type of major interaction that, will either increase the levels in your blood or decrease the levels in your blood.
Excellent. Thank you, Veronica. Here's one for Lisa. Here we go. Antibiotics are the right remedy for all acute infections.
That's a myth. Some acute infections are viral, and antibiotics don't work against them. And overuse of antibiotics will lead to resistance of those bacteria. And then what we are faced with is a lack of ability to treat infections because we're starting to see resistance patterns in some of those bugs. Those bacteria are pretty darn smart, smarter than us, smarter than the drugs that we use to treat them. And so we really want to minimize the amount of times that we're using antibiotics when it's not necessary.
Excellent. Thank you. And we'll do the last one here for Kwame. I saved this one for you because why not? I like this one. So myth or fact, Kwame, here we go. This is a common thing that I get asked by patients, but maybe we can give some a little more clarity. So here we go. Medications are best stored in the bathroom or near the kitchen sink. What's your thoughts on that?
Well, that's one of the places you don't want to store them, because as we already know, when you are in the bathroom, you take a shower, what do you produce? A lot of steam.
Absolutely.
Right, and medications, if you leave them out there, eventually steam, heat, all the conditions that will cause them to eventually break down. So just keep them in a dry place. Normal room temperature. Not in your bathroom, not in your kitchen.
Excellent. Thank you very much. So we got about 5 minutes left, guys.